What is health insurance? Health insurance is a contract between a company and a consumer. The company agrees to pay all or some of the insured person's healthcare costs in return for payment of a monthly premium. The contract is usually a one-year agreement, during which the insurer will be responsible for paying specific expenses related to illness, injury, pregnancy, or preventative care. Health insurance agreements in the U.S. generally come with exceptions to coverage, including a deductible that requires the consumer to pay certain healthcare costs out of pocket up to a maximum amount before the company coverage begins. One or more co-payments that require the consumer to pay a set share of the cost for specific services or procedures. Health insurance pays most medical and surgical expenses and preventive care costs incurred by the insured person in return for a monthly premium payment. Generally, the higher the monthly premium is, the lower the out-of-pocket costs are to the insured. Virtually all insurance plans have deductibles and co-pays, but these out-of-pocket expenses are now capped by federal law. 1. Since 2010, the Affordable Care Act has prohibited insurance companies from denying coverage to patients with pre-existing conditions and has allowed children to remain on their parents' insurance plan until they reach the age of 26. 2. Medicare, Medicaid, and the Children's Health Insurance Program, CHIP, are federal health insurance plans that extend coverage to older, disabled, and low-income people. How health insurance works. In the United States, health insurance is tricky to navigate. It is a business with a number of regional and national competitors whose coverage, pricing, and availability vary from state to state and even by county. About half of the population has health insurance coverage as an employment benefit, with premiums partially covered by the employer. More people were insured in 2021 than 2020. In 2021, 8.3% of people, or 27.2 million, did not have health insurance at any point during the year, representing a decrease in the uninsured rate and number of uninsured from 2020, 8.6% or 28.3 million. In 2021, private health insurance coverage continued to be more prevalent than public coverage at 66.0% and 35.7% respectively. Of the subtypes of health insurance coverage, employer-based insurance was the most common, covering 54.3% of the population for some or all of the calendar year, followed by Medicaid, 18.9%, Medicare, 18.4%, direct purchase coverage, 10.2%, TRSRA, 2.5%, and VA and CAMPA coverage, 1.0%. Overall, public coverage increased between 2020 and 2021. In 2021, 35.7% of people held public coverage for some or all of the year, marking a 1.2 percentage point increase from 2020. Between 2020 and 2021, the rate of Medicaid coverage increased by 0.9 percentage points to cover 18.9% of people. The uninsured rate among children under the age of 19 decreased 0.6 percentage points to 5.0% between 2020 and 2021, driven in part by an increase in public coverage. In 2021, 7.9% of full-time, year-round workers had public health insurance, up 1.8 percentage points from 2020. Among less than full-time, year-round workers, the percentage with public coverage increased 1.6 percentage points to 22.6% during this period. America Counts Stories. America Counts Story. Uninsured rate of U.S. children fell to 5% in 2021. September 13, 2022. A 1.2 percentage point increase in Medicaid and CHIP coverage drove drop in children's uninsured rate between 2020 and 2021. America Counts Story. Full-time, year-round workers more likely to be uninsured in 2021. September 13, 2022. The uninsured rate of those who worked less than full-time, year-round dropped 1.2 percentage points from 2020 to 2021 as public coverage increased. America Counts Story. Uninsured rate declined in 28 states 2019 to 2021. September 15, 2022. Today's release of the 2021 American Community Survey one-year estimates shows increase in public health coverage in 36 states.